All right, welcome back everyone to Self Principle. Self Principle is my nonprofit, which is completely separate from my day-to-day work that I do. The purpose behind Self Principle is to help you learn the most basic understanding of how to live your best life. Whether that's talking about things like nutrition, that's talking about sleep, that's talking about exercise, that's talking about just overall diet in general. The concept is to help you get all the tools you need to live your best life. So, with that, let's dive into today's topic, which is talking about the most popular drugs out there right now, which are the GLP-1s, specifically semaglutide, which goes by the brand name of Ozempic or Wegovy. And we're going to talk about sort of a rare eye disease that can lead to blindness. That was an observational study. And what I want to do is make sure you understand what it is, understand what can happen, and how much of a risk it really is. So hopefully, when you walk away from this today, you will have the tools necessary to make your own decision. Now, as you know, semaglutide or Ozempic Wegovy is used for type 2 diabetes, but its real magic, so to speak, has been around patients who have issues around their weight. In other words, they are suffering from a disease of excess weight or obesity, and they complain about the fact that there's a lot of food noise. So a lot of patients have turned towards medications hoping that that food noise will go away. And the challenge that we've talked about several times already is that there are a number of side effects to know about. Side effects such as how there's delayed gastric emptying, which means how food moves through the stomach, and sometimes people have had permanent gastroparesis. In animal models only, not in humans, the risk of thyroid cancer, the issue around Ozempic personality or thoughts of anhedonia, thoughts of depression, even some cases suicidal ideation. Now, keep in mind, FDA has come out and said that's not necessarily the case, but we always want to make sure that you understand those risks. On the benefit side, you're talking about 15% weight loss with semaglutide, and the combo drugs, which are known as tirzepatide, or GIP agonists, you can get as much as 22% weight loss, or in some cases up to around 25%. The question that you always have to weigh is not just how much weight loss you get, but what is the opposite side of the spectrum? What are the dangers? What are the side effects you want to learn about from this? So, what's important to understand, we've talked about Ozempic before, and we talked about the basic side effects, which are things like nausea, vomiting, diarrhea, constipation. Those are basics. But in addition to that, what becomes important to understand is that if there are patients who already have diabetic eye disease, we call that diabetic retinopathy. Those patients who received Ozempic or Wegovy, they actually had higher risk of their eye condition getting worse. And part of that was the thought process, at least, was that if your sugars went down rapidly, meaning your A1Cs went down rapidly, it actually led to more of the diabetic retinopathy, which can lead to blindness getting worse. And there was also risk of swelling happening, or what we call macular edema. So now we're going to talk about a whole new condition that's important to understand. This is called non-arteritic anterior ischemic optic neuropathy. That's a mouthful. So one more time. The mnemonic is NAION or NAION. And so NAION once again is non-arteritic anterior ischemic optic neuropathy. Now, the reason this is so important is it's a very rare condition. It affects about 2 to 10 people out of 100,000 people in the general population. And the way that people talk about it is they will say that it is kind of like an eye stroke, having a stroke, but in the eyes. And so nobody fully understands what happens with NAION, or this non-arteritic anterior ischemic optic neuropathy. But some people think it may be because there's reduced blood flow going to the nerve in your eye, or the optic nerve. Now, what's important to understand is that there are no available treatments. And this is really, really critical. Those people who are suffering from this condition, this optic neuropathy, they don't have a way to be able to treat it once they have it. So here's where it gets interesting. There is a neuro-ophthalmologist, Dr. Joseph Rizzo, and what he noticed was that in his clinic, some patients were developing this really rare form of blindness. And so he actually saw 3 patients in a couple of weeks and started asking the question, what's going on? And he noticed they were all on Ozempic. And so the question was, is there a link behind Ozempic and this NAION condition? And what's interesting is the most common cause of blindness, which is still very rare, but the most common cause of blindness is glaucoma. The second most common cause of blindness is NAION or non-arteritic anterior ischemic neuropathy. The reason we're talking about this, because even though this is only about 2 to 10 patients out of 100,000, the drugs that are being used for diabetes and obesity, these GLP-1s, are so widespread that it raises the risk of patients actually having this. So you want to understand if you're going to end up going on these drugs. So what is this study and why should you care? So in this particular study, it's Dr. Rizzo and colleagues. They did a retrospective. So they weren't looking forward, they were looking backwards. It's a retrospective study of looking at 16,827 patients. Now, they were looking at it specifically in Massachusetts Eye and Ear in Boston. So this is not a widespread sample. And what they really focused on was 710 patients who had type 2 diabetes. 194 of them had been given semaglutide. Then there were 979 patients who had obesity, and 361 of them were given Ozempic or semaglutide. And so what they wanted to see was they compared patients who were given semaglutide and with those who were given any other medication for weight loss or for diabetes. And of course, they tried to match these patients on things like how old they are, whether they're male or female, high blood pressure, diabetes, sleep apnea, etc. All sorts of confounding variables to make sure they could arrange it so that there was less biases. But remember, this is retrospective. They're looking backwards. So already we have biases in there. And they looked at 36 months of follow-up. So in other words, they're looking roughly around 3 years to see what happens. It's interesting to note that the data was from December 2017 to about November or so of 2023. Okay, so now, what did they find in this study and why should you be concerned or not concerned? So in the 16,000 patients that I talked about, 710 had type 2 diabetes, 194 got semaglutide. And what's interesting is half of the patients were female in the type 2 diabetes group. But in the overweight or obese group, 72% of them were female. Why does this matter? Because this may not apply to males who are taking Ozempic or semaglutide. So what's the results and what do you need to do? In the type 2 diabetics, there were 17 events that occurred in patients on semaglutide, and there were 6 events that occurred in patients on other medications. So 17 events of NAION, and there were 6 events in other patients. Now, in the patients who had type 2 diabetes, the cumulative index, in other words, all those numbers combined at 36 months or 3 years, was 8.9% for patients getting these drugs, Ozempic, Wegovy, versus 1.8% for patients getting other drugs. And so what we're seeing is that, in other words, the overall hazard ratio was about 4 times more likely for patients getting semaglutide to develop NAION, or this rare form of blindness, versus those that were getting any other drug. So the risk is there. Remember, this is a very rare disease. So even though the total number of patients getting this disease isn't that high, what's important to understand is that even though it's 17 patients versus 6 patients, the fact that so many patients are starting to use these drugs That's why the risk of this being more widespread than we have thought about is important. Now, in the obese patients, there were 20 events of this diagnosis of NAION or optic neuropathy that occurred in the patients getting semaglutide, and there were 3 events in patients getting other medications for weight loss. So the cumulative index here was 6.7% for the semaglutide group versus 0.8% in the other group. So, in other words, the risk for patients on semaglutide, Ozempic, Wegovy, to get this rare disease was about 7 times higher hazard ratio. So once again, if you're just joining us, we're talking about this rare form of blindness. Sometimes it's referred to as an eye stroke, but essentially the title is non-arteritic anterior ischemic neuropathy, and trying to look at how specifically semaglutide, Wegovy, and Ozempic may be linked to it. So now, given the fact that the risk is so much higher with semaglutide, the question is does this mean nobody should be on Ozempic or Wegovy? The answer is of course not. This study has a lot of limitations. You want to understand those. For example, this is coming from a very specialized center. So obviously, that center, which specializes in ophthalmology or eye conditions, may see the incidence more than others. That's possible. There were very small number of cases of this disease occurring. So, in other words, it's likely that there could be some confounders in there. The numbers overall are small. This is a study looking backwards. We call that retrospective. So there can be potential biases or confounders that they didn't think about. The other part is they didn't talk about the dosing. Were they on 2 milligrams, which is the weight loss dose of Ozempic, or were they on 1 milligram, which is the diabetic dose? Is there a correlation to the dosing? In other words, as you go higher, does the risk of blindness or NAION actually increase? And then the other part was, how likely were the patients to actually be compliant with the medications? In other words, if the patients aren't taking the drugs and those are the ones not getting it versus the ones who took it, got it, that answers a lot, but we don't know anything about adherence. And what if the patients who are not taking the drugs, they're getting it simply because of diabetes or obesity in of itself? So as you start to take a step back and you start to think about what is the bottom line, is when we talk about the benefits and the side effects, understanding this eye condition should be one of the side effects that you know about. It is very rare, once again, 2 to 10 people out of 100,000. But because there is no treatment for it, and because it is the second most common cause of blindness, it becomes incredibly important that you know about it and you make that decision for yourself. You talk to your doctor, make sure that you understand all of the side effects. How long are you going to be on these medications for? You understand the risk. Are you really changing your life? Because if you're not really changing your life, what happens is patients go on these drugs, and after a year or so, they lose a bunch of weight. After a year, they come back and say, Doc, the drug does not work anymore. And the reason it doesn't work is because you've been eating bad food while on the drug, and you have managed to get your body used to it. And this is why it's so important to make sure if you're going to go down the road of bariatric surgery, medications, you start with the idea of lifestyle first. And what's the basics of lifestyle? It's sleep, sleep, and sleep. You got to get 7 hours of sleep. Exercise. You got to understand, if you watch last week's video where we talk about exercise, we said resistance training is absolutely wonderful because losing weight just through calorie cutting and taking weight loss drugs, which make you eat less, it can actually increase your mortality depending on who you are. But if you are losing weight because you're lifting, you're building muscle, muscle is one of the best ways to ensure you're going to live longer. So muscle is the secret weapon. So when it comes to exercise, cardio and weight training. We talk about things like gratitude, practice gratitude. I know it's like a broken record. I talk about it every week. I talk about it every week because people just don't do it. And we want people to be able to do this stuff, practice gratitude and kindness. And then for food, once again, the direction is plants. No matter where you are, what your cultural values are, whatever you want to do, if you start with the idea of eating more plants, you're going to do so much better. Now, keep in mind these new drugs, the GLP-1s, we're still learning about them. But we know that in several diseases, obstructive sleep apnea, there's benefit. We don't know if it's because of weight loss, but we see a benefit. We talk about osteoarthritis, there's a benefit. Once again, we don't know if it's just because people lose weight and that's why their symptoms get better, or there's something specific about GLP-1s. In kidney disease, we've talked about the data. Even when compared to SGLT2s, there might actually be a benefit to adding GLP-1s onto SGLT2s. So in other words, there may be something that's there. But what's the appropriate dosing? We still need to figure out. In other words, is 1 milligram enough? Is 0.5 milligram enough to get all these benefits? Do we need something as strong as tirzepatide? Or a single agonist is enough? What about liraglutide? I know liraglutide or Victoza has lost some flavor because people look at the shiny new toy, but don't forget the tried and true. And food is all about eating a predominantly plant-based diet. You don't have to go 100%. Whatever you can do will make a difference. So there you have today's topic. Let's go on to the questions next. So if you got any questions, pop them in the chat. If you guys are on YouTube or Instagram, feel free to pop those questions in there and we're going to go through all your questions now. All right, so let's take a look at our questions. Let's see. Kenneth said, Dr. Sean, you are a wealth of information. Bless you and your family. Kenneth, thank you so much. And right back at you. Bless you and your family as well. And I know you guys have much better things to do on a Wednesday evening than to listen to me. So thank you for joining. And the greatest compliment you can ever do is share this information and spread the word. Once again, there's nothing for me to get out of this. This is part of the nonprofit work that I do. The hope is that you feel like you're learning something from this channel. Let's see. Beth said, hi, doctor. Thank you for your help. Have you heard of the clinical study showing how terminal is Bellerica, fruit from a tree, showing uric acid and creatinine levels significantly reduced for chronic kidney disease patients? So Beth, let me go back and review it. You know, Michelle and I had looked at this data and we weren't very much impressed with it. It seemed like it was a little bit more hope and a little bit more hype than the fact that we actually had data to be able to answer that question. Vincent is talking about his A1C is 5.7. So Vincent, at 5.7, you can go ahead and make it much better simply by diet. You know, 5.7 is just going into the pre-diabetes range. But if you're there, diet makes the biggest difference. You got to really look back at what you're eating. What are the processed foods that are in there? What are the foods that are in simple sugar? The breads, the pastas, can you switch those to whole grains? Can you make sure that your bigger meals are earlier in the day? What about strength training? Are you doing your strength training? What about sleep? Is there an opportunity for you to work on your sleep? All of those little things can make a difference. Next. Carol asked the question, do you recommend omega-3 supplements? So Carol, it depends on what you're looking at omega-3s for. If you're looking at brain health, the data is very interesting when it comes to omega-3s. There's some data around omega-3s for migraines. And so for those things, it can actually help. And that's why myself, I take it. The cardiovascular data, as you know, it hasn't been as good as people hoped. So that's probably where, if you're just taking it for that, not really. If you're somebody who's into eating fish, then you're getting your omega-3s. If you're somebody who's plant-based or vegan, you can get algae-based omega-3 supplements. It just depends on where you're at. So that's there. Let's see. Vincent said, I lost another 10 pounds. What can I take other than Ozempic? So Vincent, some of the basics are there's SGLT2 inhibitors, there's metformin. Those are all medications that are used in patients who may be diabetics. They may have kidney disease, heart disease. Those are used. Remember, metformin, we don't start it on patients with a kidney function less than 45. If they're already on it, then we will reduce the dosing. But it's very, very important that you want to talk to your doctor and figure out what might be causing this. Dee said, did anyone taking tirzepatide have this rare blindness? So this study was not looking at tirzepatide. It only looked at semaglutide. I remember, because this study was going earlier, December 2017 to 2023, tirzepatide had really not kind of made its way. So the answer is no. We wouldn't have the data around tirzepatide. But if you look at what tirzepatide is, it is GLP-1 and a GIP. So the answer is this same study would be a concern for that as well. Not me said, how about being carnivore? Is it bad if I have glaucoma? Well, so when it comes to carnivore diet, it's just the acid load on all of your organs. I can't speak to glaucoma because I don't have an answer as far as that goes. But what I would say is, for the rest of your body, there is no positive data on the carnivore diet. You can go ahead and look at all the studies, and there are thousands of studies on nutrition that have been published over decades, but you won't be able to find any that support a carnivore diet. So that always makes it tough. Let's see. God 563 616. I'm just getting on here from work. I was approved by my doctor to take GLP-1. Is this the same as Ozempic? Yes, Ozempic is a GLP-1. Specific name is semaglutide. It also goes by the name of Wegovy. Vincent said, once in a blue moon, I eat pasta. That's Vincent, we're all human. But always try to figure out what are the options and work with your provider, because of the fact that your case is individual and no doctor on the internet can ever give any patient-specific advice. We can only give general advice. We can never give specific advice to someone. So it makes it very important. Let's see. Someone said, so God 563616 said, my doctor, meaning my kidney transplant doctor. Yeah, so once again, we've talked about the fact that GLP-1s like Ozempic may have a kidney protective role. So remember that. Let's see. Teresa said, hi, doctor. Thank you for your dedication. Thank you, Teresa. And thanks for joining again. So glad to see you over here. McFarley said, I'm learning so much. That's awesome, because that's my goal, is to help everyone on this channel learn. That's it. That's the idea behind it. And let's see. Vincent said, I'm going to go blind. So Vincent, none of this data means somebody's going to go blind. It's just to make sure you're aware of what are the odds. That's it. That's all it is. So remember, everything is a risk and benefits. The problem most patients have is that sometimes they only hear the good side of everything. And so it's like the shiny new toy. People jump on the shiny new toy, and you want to make sure that you hear all the good and the bad, so that we can make sure that we are taking better care of you. Let's see, Didi said, can diabetics eat potatoes? I'm wanting to switch over to a whole food plant-based diet. The answer is absolutely yes. And if you're somebody who likes sweet potatoes, that's even better. But remember, a lot of people who eat potatoes, it's not the potatoes that should get all the blame. It's the fact that we fry them, we fill them up with salt. So remember, the worst kind of food you can possibly have, the worst kind of food, is French fries. And I get it, French fries taste amazing, but remember, French fries are the worst thing because of the fact that they have salt, sugar, and fat. It's the trifecta. If you put salt, sugar, and fat into one food, it's the most addictive substance. And this is why, remember the commercial on Lay's? It said you just can't have one. It's true. That's why Lay's potato chips are so darn addictive. On Instagram, there's a question. Can patients with stage 4 CKD start Farxiga? Is there data that supports the use of Ozempic in combination? So remember, we're talking about SGLT2 inhibitors. And yes, there is data that now shows that you can use SGLT2s and combine them with drugs like GLP-1s, like Ozempic, Wegovy. So the answer to your question is that both of those do exist, and you can do that. And if you have type 2 diabetes in remission, remember, with SGLT2s, the simple explanation for what SGLT2s is. It's like being on essentially a ketogenic diet. They make you pee out sugar. What's the problem? Is you're peeing out sugar. So as a result of it, you can get urinary tract infections, you can get bacterial, you can get fungal infections, you can get some very nasty infections down there. So you don't want to hold your pee. You want to make sure you're working on your diet. And of course, you want to make sure that from a hygiene perspective, the area down there is clean and dry. Those are the basics, but you got to make sure those things are happening. All right, next up, let's see. Also said it protects heart and kidneys. So the answer is when you talk about GLP-1s, the data shows that when patients have had a heart attack, there's a select trial that showed that when patients were given semaglutide, it was protective against major adverse cardiovascular events. So that was the issue with that. But when it comes to this issue of blindness, the idea behind GLP-1s is we just don't know enough. But this is the first study to actually call this out and to understand it. So if you're somebody who's on it, this is worth having a conversation with your doctor so that you guys can make sure that you're talking about this at least. And then let's see. McFarley said, do we need to get eye exams every 6 months or yearly if using Ozempic? The challenge is this study is so new. And because it's so new, nobody has a clue if this is a risk that is going to be widespread or this is a risk that is small. Remember, one of the issues with this study is that the patients who got NAION or non-arteritic anterior ischemic optic neuropathy, the people who got this, we don't know what the dosage of the drug they were on. We don't know how compliant they were. So once again, what if the patients who got this disease weren't sticking to the drugs? Instead, they got it because they were diabetics and they were having excess weight, and that's what put them at risk. So if that's the case, then all of this data might be a moot point. So in other words, we need more studies. Now that it's been called out, it makes a whole lot of sense for us to get more studies and see what's happening. Question was conjugated linoleic acid. So CLA has been touted forever to cause weight loss. Unfortunately, it does so little for weight loss that you're just better off working on your diet and working on your exercise. So if you want to understand how to eat better, just go listen to Michelle over at Plant-Based Kidneys, and you can learn all about what are the changes you got to make so you can start to eat better. You know, Michelle and I have done so many videos around the food aspect. So if you're missing out on that, the basics apply. But CLA, you can look at the studies that have done it. The weight loss is very little. It actually doesn't make a whole lot of sense from that perspective to go ahead and use. All right, in the last minute that we have left, once again, for all of the folks that joined, thank you so much for joining. I always try to remind everybody, guys, there are so many gurus on the internet that you have to be careful. Please don't go seeking advice on the internet from doctors or anybody pretending to be a doctor or an expert. I am not an expert. I want you to know that. I do this because I really feel it's important for people to have access to information in a way that they can easily understand. So the hope is you can take these conversations and discuss with your provider. And at the end of your life, once again, nobody will care how smart you were. Nobody will care how many houses you have or what fancy car you have. People will only remember how you made them feel. And that's it, how you made them feel. So if there's one message, and if nobody's promised tomorrow, so if tomorrow is my last day or tonight is my last day, I hope that you understand the most important thing I tried to teach was kindness. More so than any knowledge was just plain kindness. So with that, thank you so much. Take care, everyone. Be kind to each other, and I'll see you